This video series is funded by Jewish Hospital Foundation, Norton Healthcare, and the United States Surgical Corporation.
We'll look at the lower extremity in 4 sections. In this first section, we'll look at the hip. After that, we'll look at the knee. Then we'll go down to the ankle, and lastly, we'll look at the foot. Before we get started, there's a simple term we need to define: the leg. In everyday speech, the leg means everything from the hip downwards. But in anatomy, only this part, from the knee to the ankle, is the leg, and this part, from the hip to the knee, is the thigh. In looking at the hip region, we'll start with the bones. After that, we'll look at the hip joint and its movements, and then we'll look at the muscles which produce those movements. Lastly, we'll look at the vessels and nerves. First, let's see the bones. Here are the lumbar vertebrae, the pelvis, and the 2 femurs. We'll look at the pelvis by itself. The pelvis is made up of the 2 hip bones, or innominate bones, and the sacrum. The fibrous joints which unite them, the 2 sacroiliac joints behind, and the pubic symphysis in front, permit almost no movement. We look at the right hip bone by itself. The hip bone is formed by the fusion of 3 bones: the ilium, the ischium, and the pubis. The names of these bones give rise to the names of the various features of the hip bone. Let's look at these features. This broad bony plate is the wing or ala of the ilium. Its broad roughened edge is the iliac crest, an area where many important muscles attach. The iliac crest ends in front at the anterior superior iliac spine, and behind at the posterior superior iliac spine. This is the ischial spine, with the greater sciatic notch above it and the lesser sciatic notch below it. This is the ischial tuberosity. The ischial tuberosity is another area where many muscles attach. It's also the part of the hip bone that we sit on. The socket for the hip joint is called the acetabulum. This broad, smooth area is the articular surface. We'll see it again in a minute with the articular cartilage intact. The big hole in the lower part of the hip bone is the obturator foramen. This is the body of the pubis, this is the superior ramus of the pubis, and this is the ischiopubic ramus. This prominence is the pubic tubercle, to which the inguinal ligament is attached. It's helpful to keep in mind that the upper part and the lower part of the hip bone face in different directions, like my hands. So when we look at the hip bone from in front, like this, we see the inner aspect of the ilium and the outer aspect of the pubis and ischium. Now that we've looked at the hip bone, let's bring the sacrum back into the picture. We're looking at the bones as they'd be in the upright standing position. And it's perhaps surprising to see the angle at which the sacrum lies. Its pelvic surface is more nearly horizontal than vertical. The sacrum is attached to the hip bone not only by the sacroiliac joint, seen here from behind, but also by 2 big ligaments, one going to the ischial spine and one going to the ischial tuberosity, as we'll see in a minute. Now let's add the femur to the picture. The femur is the longest bone in the body. We'll be looking at its distal end in the next section. For now, let's look at the features of the proximal end. This is the head of the femur. This is the neck.
Since the head is wide and the neck is narrow, the head of the femur can go a long way in this axis and in this axis before bone hits bone. This prominent lump is the greater trochanter, and this one is the lesser trochanter. The greater and lesser trochanters are important muscle insertions. This line, the intertrochanteric line, marks the insertion of a major ligament of the hip joint, which we'll see in a minute. On the back of the femur, this prominent ridge, the intertrochanteric crest, runs from the greater to the lesser trochanter. This broad rough area is the gluteal tuberosity. This rough line running down the shaft of the femur is the linea aspera. Many muscles have their origins or their insertions on the linea aspera, on the gluteal tuberosity, and in this hollow in front of the intertrochanteric crest. Now that we've looked at the dry bones, let's see how they look in the living body. The big gap between the sacrum and the ischium is bridged by two massive ligaments. The sacrospinous ligament goes to the ischial spine. The sacrotuberous ligament goes to the ischial tuberosity. Let's go round to the front and see those two ligaments from the inside. Here's the sacrospinous ligament. Here's the sacrotuberous ligament. These two openings are the lesser sciatic foramen and the greater sciatic foramen. The sciatic nerve passes through the greater sciatic foramen. The obturator foramen is largely closed by the obturator membrane. The obturator nerve and vessels pass through a small tunnel here. Now let's take a look at the hip joint. We'll remove the femur for a moment and look at the acetabulum. Here's the broad C-shaped articular surface, sometimes called the lunate surface. This non-articular part of the acetabulum is the acetabular fossa. Around the edge of the bony acetabulum, this rim of fibrocartilage, the acetabular labrum, adds to the depth of the acetabulum. This is the cut end of the ligament of the head of the femur. Its other end is attached here on the center of the femoral head. Now let's go back to the intact hip joint. The capsule of the hip joint is a sleeve of ligaments. The capsule is thin on the underside. Everywhere else, it's thick and very strong. This part of the capsule behind is called the ischiofemoral ligament. This anterior part of the capsule, which is the thickest, is known as the iliofemoral ligament. The fibers of these capsular ligaments become tight when the joint is extended. The capsule is attached to the hip bone all the way around the acetabular labrum. On the back of the femur, the capsule is attached partway along the femoral neck. On the front of the femur, the capsule is attached out here on the intertrochanteric line. Now let's take a look at the various different movements that occur at the hip joint. Movement can occur in three different axes. Forward movement is flexion. Backward movement is extension. Movement out to the side is abduction. Movement toward or across the midline is adduction. Lastly, rotation. Rotation outward is lateral rotation. Rotation inward is medial rotation. Rotation at the hip joint is accompanied by marked backward and forward movement of the greater and lesser trochanter. Now we're almost ready to move on and look at the muscles of the hip region. Before we do that, let's take a minute to review what we've seen of the bones and of the hip joint. If you'd like to use this next review section to test yourself, turn off the sound and see how many of the structures you can name. There's another blue sign like this one at the end of the review section. Here's the wing of the ilium, the iliac crest, the anterior superior iliac spine, the posterior superior iliac spine, the ischial spine, the ischial tuberosity, the acetabulum, the obturator foramen, the body of the pubis, the superior pubic ramus, the ischiopubic ramus, and the pubic tubercle. On the femur, here's the head, the neck, the greater trochanter, the lesser trochanter, the intertrochanteric line, the intertrochanteric crest, the gluteal tuberosity, and the linea aspera. Here are the sacrospinous ligament, the sacrotuberous ligament, the ischiofemoral ligament, the iliofemoral ligament, and the obturator membrane.
Now let's move on to look at the muscles that produce movement at the hip joint. There are 5 muscle groups to look at: the short rotators, the flexors, the adductors, the abductors, and the extensors. We'll look at the 6 short rotator muscles first, because they lie deep to all the others.
The short rotator muscles arise from 4 different bony surfaces: the inner surface of the sacrum, both the inner surface and the outer surface of the area around the obturator foramen, and from the outer surface of the ischium. They all converge on this small area on the back of the femur, just medial to the greater trochanter. The one that arises from the sacrum is piriformis. Here it is. Piriformis arises from here on the sacrum. It leaves the pelvis by passing through the greater sciatic foramen, along with the sciatic nerve. We'll go right round to the back to see where it comes out. Here's piriformis emerging. It inserts here, high up on the medial aspect of the greater trochanter.
Piriformis is an important muscle to understand because it's closely related to a very important structure, the sciatic nerve. Now we'll look at the 2 obturator muscles, obturator internus and externus. They lie on each side of the obturator membrane.
Here's obturator externus. It arises from the obturator membrane and from the adjoining edge of the ischiopubic ramus. Obturator externus passes backward just beneath the neck of the femur. Here's its tendon, passing laterally to reach its insertion here, below piriformis. Next we'll see obturator internus, which comes around the back of the ischium here from inside the pelvis. We'll go around this way to see where it arises. Here's obturator internus. It arises from this wide area on the ilium and ischium, and from the obturator membrane. It leaves the pelvis through the lesser sciatic foramen. As it passes round the back of the ischium, obturator internus does a 90-degree turn. As it makes the turn, it's joined above and below by these 2 little muscles, gemellus superior and gemellus inferior. They arise from the ischium here and here. Along with obturator internus, they're inserted here. The last of the short rotators is quadratus femoris. Quadratus femoris arises from the ischial tuberosity here and inserts on the femur here on the intertrochanteric crest. All these short rotator muscles have the same action. By pulling the back of the femur medially, they produce this movement, lateral rotation at the hip joint. When the foot is on the ground, the same muscle action produces what appears to be a different movement, rotation of the trunk to the opposite side.
So contraction of these muscles has 2 possible effects, depending on whether the limb is free to move or whether it's fixed. As we'll see, that holds true for every muscle that produces movement at the hip joint. Now we'll move on to look at the groups of muscles which produce adduction and abduction at the hip. We'll look at the 5 adductors first. There are 3 named adductors: adductor magnus, brevis, and longus. And there are 2 other muscles which adduct: pectineus and gracilis.
The adducting muscles all arise from this region on the ischium and pubis. And they're all inserted along this line. The lowest one, gracilis, right down here on the tibia. Let's start with the named adductors. Here's the largest of them, adductor magnus. Adductor magnus arises from the outer border of the ischiopubic ramus. Its insertion is in 2 parts, with a gap in between. The upper part of adductor magnus inserts here on the linea aspera. The lower part inserts here on the adductor tubercle of the femur. The gap in adductor magnus is the adductor hiatus. The main blood vessels to the leg pass through here, from the front of the thigh to the back. The other 2 named adductors, brevis and longus, sit in front of adductor magnus. Here's adductor brevis. Here's adductor longus. Brevis arises here on the body of the pubis. Longus arises here. They're inserted on the femur right next to adductor magnus, brevis above, longus below. The insertion of adductor longus stops just short of the adductor hiatus. The other 2 adducting muscles are a short muscle, pectineus, and a very long muscle, gracilis. Pectineus is the shortest of the adductors. It arises from this line on the superior pubic ramus. It inserts here, just in front of adductor brevis. Gracilis is the most medial of all the thigh muscles. It arises here on the pubis, and it's inserted all the way down here on the tibia. The main effect of all these muscles is to produce adduction at the hip joint.
Gracilis is the first muscle we've met which crosses both the hip joint and the knee joint. We'll be meeting more muscles like it quite soon. A muscle that crosses both the hip and the knee can either act at the hip, at the knee, or at both joints at once. The movement that it does produce is determined by what other muscle groups are acting at the same time. For now, when we look at a muscle that goes from above the hip to below the knee, we'll just look at the way it acts at the hip. In the next section, we'll take a second look at each of these muscles and see how it acts at the knee. Now let's move on and look at the 3 muscles which produce abduction at the hip joint. The 2 important abductors are gluteus minimus and gluteus medius. We'll go around the back to look at them.
Here are the short rotator muscles that we've seen already: quadratus femoris, obturator internus and the gemelli, and piriformis. Now we'll add gluteus minimus to the picture. Gluteus minimus arises from this part of the wing of the ilium. It's inserted here on the front of the greater trochanter. Overlying gluteus minimus is gluteus medius. Gluteus medius arises from this part of the ilium. It's inserted here on the outer aspect of the greater trochanter. Though gluteus medius is mainly an abductor, as we'll see, its anterior part also produces medial rotation at the hip.
The last of the abductors is called the tensor fascia lata. Before we look at it, we need to digress for a minute and get acquainted with the structure that gives it its name, the fascia lata.
The fascia lata is a continuous sheet of dense fibrous tissue that surrounds all the muscles of the thigh. Along the outer aspect of the thigh, there's a very marked thickening of the fascia lata called the iliotibial tract. The iliotibial tract extends all the way from here on the ilium down to here on the tibia. Here's the iliotibial tract by itself, with the rest of the fascia lata removed. These muscles, in front of it and behind it, we'll be looking at in a minute. Between the muscles is a strong fibrous septum, which attaches the iliotibial tract to the femur. At its lower end, the iliotibial tract is attached down here on the tibia. The iliotibial tract acts as the tendon of insertion of two muscles. A big one back here, gluteus maximus, which we'll see later, and this one, which we were just getting ready to look at, tensor fascia lata. Tensor fascia lata arises from the iliac crest, here. It inserts here on the iliotibial tract. The three hip abductors move the limb to the side. When the foot is on the ground, the hip abductors, pulling down on the ilium, raise the opposite side of the pelvis up. This tilting of the pelvis happens in a small way each time we take a step, making it easy for the opposite foot to move forward without touching the ground. Now let's move on to look at the muscles which produce flexion at the hip joint. There are four, two that act only at the hip and two that act at the hip and also at the knee. The first two are the most important hip flexors. They're called iliacus and psoas major. Iliacus arises here from the iliac crest, psoas major from all the way up here on the lumbar spine. Here's psoas major. Psoas major arises from the transverse processes of all five lumbar vertebrae and from the sides of the intervertebral discs and the adjoining vertebral bodies. We'll see its insertion in a moment. Here's iliacus. Iliacus arises from almost all of the inner aspect of the wing of the ilium. As they pass downward together, iliacus and psoas major pass over the superior pubic ramus and under a structure here that we haven't been introduced to yet, the inguinal ligament. The two muscles pass downward and backward and insert together down here on the lesser trochanter. Contraction of the iliacus and psoas major produces flexion of the hip joint. When the limb is free to move, flexion brings the thigh forward. When the limb is fixed, as it is here, flexion of both hips brings the body upright. The other two muscles which help in hip flexion are rectus femoris and sartorius. They're more important for their actions at the knee than for their actions at the hip. We'll look at them briefly here and in more detail in the next section. Rectus femoris is part of a huge muscle with four heads called quadriceps, which we'll see in a moment. First, let's briefly review the muscles we've seen already: psoas major and iliacus, pectineus, adductors brevis, longus, and magnus, and gracilis. Now let's add quadriceps to the picture. All this is quadriceps. It's the main muscle that extends the knee. The only part of quadriceps which acts as a hip flexor is this part, rectus femoris. It's the only part that arises from above the hip joint, which is here. Rectus femoris arises by two heads, from here and here, just above the acetabulum. Its final insertion, along with the other three heads of quadriceps, is right down here on the tibia. Rectus femoris is quite a weak hip flexor. Now we'll add the last hip flexor, sartorius. Sartorius is a very long, narrow muscle that lies outside all the others. It runs in a spiral, starting here on the anterior superior iliac spine and ending up all the way down here on the tibia. Sartorius helps to flex the hip. It can also produce lateral rotation at the hip.
Now we'll move on to look at the four muscles that extend the hip. The first three, which are known collectively as the hamstring muscles, act at the hip and at the knee. The fourth one, gluteus maximus, acts only at the hip. We'll come to it last because it lies outside the others and covers them up.
Here's the back of the thigh as we saw it last. Here's gluteus medius. Here are all the short rotators. Here's adductor magnus. And here's the back of quadriceps. The three hamstring muscles all arise from the ischial tuberosity. Here they are. Two of them run to the medial aspect of the leg. One runs to the lateral aspect. The lateral one is biceps femoris. The two medial ones are semimembranosus and semitendinosus. Here's semimembranosus by itself. It has a long, flat, membrane-like tendon of origin, which arises from here on the ischial tuberosity. It's inserted here on the back of the tibia. Here's semitendinosus, lying behind semimembranosus. It has a long cord-like tendon of insertion. It arises from here, next to semimembranosus. It inserts down here on the medial aspect of the tibia, close to two other muscles that we've seen already, sartorius and gracilis. Now that we've seen the two semi-muscles, we'll add biceps femoris to the picture. Biceps femoris has two heads of origin, a long head and a short head. The long head arises from here on the ischial tuberosity, along with semitendinosus. The short head arises from almost the whole length of the linea aspera, and from this supracondylar line. The two heads of biceps femoris join together, forming a tendon that runs down behind the lateral aspect of the knee, then runs forward to insert here on the head of the fibula.
We'll be taking another look at the hamstring muscles and their actions at the knee in the next section. We'll look at their action at the hip in a minute, but before we do that, we'll add the last and largest of the hip extensors, gluteus maximus, to the picture.
Here's the upper end of the hamstring muscles. Here, overlying them, is gluteus maximus. It's a thick, flat sheet of muscle. Gluteus maximus arises from here on the back of the ilium, and from the side of the sacrum, and from the sacrotuberous ligament. The upper 3/4 of gluteus maximus inserts into the iliotibial tract. The lower 1/4 of gluteus maximus passes more deeply and inserts here on the back of the femur on the gluteal tuberosity.
Now let's look at the actions of the hip extensor muscles, starting with the hamstring muscles.
Contraction of the hamstring muscles can produce both knee flexion and hip extension. When knee flexion is held in check by the action of quadriceps, the hamstrings just produce extension at the hip, which is the action that propels us forward in normal walking.
Gluteus maximus isn't used in the gentle action of normal walking. It comes into play when a powerful action is needed, especially an action that opposes the force of gravity.
The action of gluteus maximus extends the hip from a position of full flexion, as in climbing stairs or rising from a squatting or sitting position. The same action, balanced against the force of gravity, controls the rate of hip flexion as we sit down.
Gluteus maximus is one of the two big anti-gravity muscles of the lower extremity. The other one, acting at the knee, is quadriceps, as we'll see in the next section. Gluteus maximus has yet another set of actions when the lower extremity is fixed and upright.
Then the action of gluteus maximus pulls the back of the pelvis downward, raising the body from a forward bend at the hips, or when balanced against gravity, controlling the rate of bending forward.
Now we've looked at all the muscles that produce hip movement. As we've seen, several of them also have important actions at the knee, and we'll be looking at these a second time in the next section. We're almost ready to move on to look at the vessels and nerves of the hip region, but before we do that, let's review what we've just seen of the muscles.
Here's gluteus maximus, biceps femoris, semitendinosus, and semimembranosus. Here's gluteus medius and gluteus minimus. Here's piriformis, obturator internus, and quadratus femoris. And here's adductor magnus, seen from behind. On the front, here's tensor fascia lata, sartorius, and rectus femoris. Psoas major and iliacus, pectineus, adductor brevis, longus, and magnus, and gracilis. And here again are piriformis, obturator internus, and obturator externus.
Now we'll move on and look at the blood vessels and nerves of the hip region. We'll follow the course of the vessels and nerves from the inside of the body to the proximal part of the thigh. In the next section, we'll follow them on down to below the knee. To understand the course of the main blood vessels, the femoral vessels, there's a structure we need to look at that we saw briefly before, the inguinal ligament. And there's a space between muscles that we need to understand called the femoral triangle.
Here's the inguinal ligament. It's a strong, tight band that forms the lowest part of the anterior abdominal wall. The inguinal ligament passes from the anterior superior iliac spine to the pubic tubercle. The inguinal ligament isn't an isolated structure. It's the lower edge of this large sheet of tendon-like material, the external oblique aponeurosis. The inguinal ligament is this part here. The fascia lata, which we've seen already, is attached to it along here. The gap between the inguinal ligament and the superior pubic ramus is occupied partly by the iliacus and psoas muscles, and partly, as we'll see, by the femoral nerve, artery, and vein, and the inguinal lymph nodes. The other muscle in the picture here is obturator externus. Now let's add all the other thigh muscles to the picture and see the femoral triangle. Here the fascia lata has been left intact. Here it's been removed. The femoral triangle is the name given to this deep hollow. It's bounded by sartorius laterally, adductor longus medially, and the inguinal ligament above. In the depths of the triangle, pectineus, psoas major, and iliacus pass backward toward their insertions.
Now that we understand the inguinal ligament and the femoral triangle, we can move on and look at the blood vessels of the hip region, starting with a brief look at the principal veins. Almost all the veins in the region run parallel to arteries of the same name, so we don't need to look at them all separately. But there's just one important vein we do need to look at that has no corresponding artery, the long saphenous vein, also called the greater saphenous vein. With the main vein, there's a change of name that we need to understand. Below the inguinal ligament, it's called the femoral vein. Above the inguinal ligament, it's called the external iliac vein. It's the same with the artery. The vessels themselves don't change, just their names.
Here's the thigh with just the skin removed. The anterior superior iliac spine is here. Here's the long saphenous vein, which starts at the ankle and passes up the medial side of the knee and up to the top of the thigh. We'll remove all the subcutaneous fat to see it better. The inguinal ligament runs from here to here. Here's the fascia lata. Superficial veins from other parts of the region join the upper end of the long saphenous vein, which passes through an opening in the fascia lata, the saphenous hiatus. Here, near the top of the saphenous vein, are two of the inguinal lymph nodes. The main lymphatic vessels draining the lower extremity pass under the inguinal ligament here. To see where the saphenous vein goes, we'll remove the fascial outer and the underlying fat. Here are the main blood vessels to the leg, the femoral vein and artery, and this is the femoral nerve. The long saphenous vein ends by joining the femoral vein here. The femoral vein passes beneath the inguinal ligament. To see where it goes, we'll remove the abdominal wall, leaving just the inguinal ligament. This is the inguinal ligament. This is the top of the pubis. Here, the vein is called the femoral vein. Here, above the inguinal ligament, it's the external iliac vein. It's all the same vessel. To see where it goes, we'll remove the artery. This muscle is the psoas major. The external iliac vein is joined by the internal iliac vein to form the common iliac vein. The right and left common iliac veins join in the midline to form the inferior vena cava.
Now we'll remove all the veins from the picture so that we can look at the arteries. We'll look first at the internal and external iliac arteries. Then we'll look at the femoral and deep femoral arteries, which supply almost all of the lower extremity. Then we'll look at the gluteal arteries, which supply the gluteal or buttock area.
Here's the abdominal aorta, dividing to give off the left and right common iliac arteries. The common iliac divides into the internal iliac and external iliac arteries. The external iliac passes under the inguinal ligament, emerging as the femoral artery. The femoral artery gives off two small branches and one large branch. The small branches are the superficial circumflex iliac, which runs laterally, and the external pudendal, which runs medially. The large branch is the deep femoral artery, which we'll look at in a minute. The femoral artery itself runs downward and passes beneath the sartorius muscle. We'll follow its further course in the next section of this tape.
Below the point where it gives off the deep femoral, the femoral artery is often referred to as the superficial femoral. It supplies everything from about here downward, but the main artery that supplies the thigh is the deep femoral.
To follow the deep femoral artery, we'll remove the femoral artery. We'll also remove the sartorius muscle and the femoral nerve. Early in its course, the deep femoral gives off two large branches, the medial circumflex femoral and the lateral circumflex femoral. It then passes behind adductor longus, which we'll remove. Here's pectineus, adductor brevis, adductor magnus, rectus femoris. The deep femoral artery runs down in front of adductor brevis and adductor magnus, giving off numerous muscle branches, including several which run backward through adductor magnus to supply the posterior thigh muscles.
Now we'll go up to the internal iliac artery again to look at the gluteal vessels, which provide the blood supply for the buttock.
The left side of the pelvis has been removed to give us a better view. Here's the internal iliac artery. Its branches which go to the pelvic viscera have been divided. Arising from it and a little discolored in this specimen are the superior gluteal and inferior gluteal arteries. They both pass backward through the greater sciatic foramen, one above and one below the piriformis muscle, which is here. To see where they emerge, we'll go right round to the back and remove gluteus maximus. Here's piriformis, here's gluteus medius. Again, all the veins have been removed to simplify the picture. Here's the superior gluteal artery, and here's the inferior gluteal artery, branching to supply the muscles of the buttock region.
Now that we've looked at the blood vessels of the hip region, we can move on to look at the nerves. We'll look first at the femoral nerve and the obturator nerve, which supply the front and the medial aspect of the thigh. Then we'll look at the gluteal nerves and the sciatic nerve, which supply the buttock and the back of the thigh. All the nerves of the lower extremity come from the anterior rami of the second to the fifth lumbar nerves and the first, second, and third sacral nerves. To see where these arise, let's take a look at the lumbar spine and the sacrum.
Below each vertebra, there's an intervertebral foramen. An anterior ramus emerges through each foramen. The anterior rami of the sacral nerves emerge from the anterior sacral foramina. Each anterior ramus is numbered according to the vertebra or the sacral segment that's above it. Here's the third lumbar vertebra. Here's where the L3 ramus emerges. We'll start by looking at the femoral nerve and the obturator nerve. This is the femoral nerve. This is the obturator nerve. This white structure in between is the psoas major tendon. Both these nerves arise from the lumbar plexus, which lies up here within the thickness of the psoas major muscle. The femoral nerve emerges lateral to psoas major, the obturator nerve medial to it. We'll follow the femoral nerve. It runs across the iliacus muscle and passes under the inguinal ligament, just lateral to the femoral artery. Below the inguinal ligament, the femoral nerve breaks up into several branches. The femoral nerve supplies iliacus, all four heads of quadriceps, and also pectineus and sartorius. Now let's look at the obturator nerve. Emerging below the medial border of psoas major, it crosses the wing of the sacrum, then runs along the back of the ischiopubic ramus. It leaves the pelvis by passing forward through the obturator canal, just above obturator internus. To see where it emerges, we'll remove pectineus. Here's the obturator nerve emerging over the top of obturator externus. Its branches run down between the adductor muscles. The obturator nerve supplies obturator externus, adductor brevis and longus, and the anterior part of adductor magnus.
Now we'll look at the two gluteal nerves, the superior and the inferior, and at the largest nerve of the lower extremity, the sciatic nerve, which supplies the posterior thigh muscles and almost everything below the knee. The gluteal and sciatic nerves arise from the sacral plexus.
Here's the sacral plexus. It's formed by the anterior rami of L4 and 5 and S1, 2, and 3. The sacral plexus overlies the piriformis muscle. This is the sciatic nerve. It arises from L4 through S3. This is the superior gluteal nerve. The inferior gluteal nerve arises out of sight behind the sciatic nerve. All three nerves leave the pelvis through the greater sciatic foramen. To see where they come out, we'll go round to the back and remove gluteus maximus. Here the vessels have been removed to simplify the picture. Here's piriformis. Here's the sciatic nerve. Here's the inferior gluteal nerve. And here's the superior gluteal nerve, disappearing beneath gluteus medius. The superior gluteal nerve supplies gluteus medius, gluteus minimus, and tensor fasciae lata. The inferior gluteal nerve supplies gluteus maximus. The sciatic nerve runs down the middle of the thigh. Deep to it are quadratus femoris and lower down adductor magnus. This is the long head of biceps femoris, which crosses over the nerve obliquely and covers it up. We'll follow the sciatic nerve further in the next section of this tape. In the thigh, the sciatic nerve supplies semitendinosus and semimembranosus, and also biceps femoris and the posterior part of adductor magnus.
Lastly, there are a few hip muscles which have their own individual nerve supply.
Psoas major is supplied by several small branches of the lumbar plexus. Small separate branches of the sacral plexus supply piriformis, obturator internus, and quadratus femoris.
Now let's review the vessels and nerves of the hip region.
Here's the long saphenous vein and the femoral vein, becoming the external iliac vein. Here's the common iliac artery, the internal iliac, giving off the superior gluteal and inferior gluteal arteries. Here's the external iliac, becoming the femoral artery. Here's the superficial circumflex iliac and the external pudendal. Here's the deep femoral, giving off the lateral circumflex femoral and the medial circumflex femoral arteries. Now the nerves, the femoral nerve, the obturator nerve, the sciatic nerve, the inferior gluteal nerve, and the superior gluteal nerve.
That brings us to the end of this section on the hip region. In the next section, we'll look at the knee. In this section, we'll look at the knee. First, we'll look at the bones, then the knee joint and how it moves, then the muscles that move it, and lastly, the vessels and nerves. Let's see the bones, starting with the femur.
We saw the proximal end of the femur in the last section. Now let's look at the distal end. The two smoothly curved surfaces are the lateral condyle and the medial condyle. The deep notch which separates them is the intercondylar notch. Above the two condyles are the epicondyles, lateral and medial. The sharp corner on the medial epicondyle is the adductor tubercle. This prominent ridge is the medial supracondylar line. This one is the lateral supracondylar line. Now we'll add the tibia and the fibula to the picture. The tibia and the fibula are fixed to each other firmly by two joints, the proximal and distal tibiofibular joints. There's almost no movement at either of these joints. Let's take a look at the proximal end of the tibia. This is the medial condyle, this is the lateral condyle. On top of the two condyles are two quite separate articular surfaces. They're much flatter than those on the femur. The rugged expanse between the articular surfaces is the interarticular area. This prominent lump on the front, the tibial tubercle, is the final insertion of the quadriceps tendon. The small facet under here is for the fibula, which we'll add. This is the head of the fibula, this is the neck. The head of the fibula is the point of attachment of a major ligament of the knee joint, as we'll see. The space on each side of the knee between the femoral condyle and the tibial condyle is occupied by a crescent-shaped piece of cartilage, a meniscus, which we'll see shortly. The space in the middle, the intercondylar notch, is occupied by the two cruciate ligaments. The intercondylar notch and its contents divide the knee joint into two almost separate halves. There's one more bone to add to the picture, the patella, or kneecap. The patella, as we'll see, is embedded within the quadriceps tendon, which comes from up here and inserts on the tibia down here on the tibial tubercle. On the back of the patella, the articular surface is divided into facets. These articulate either with the femoral condyles when the knee is flexed, or with this central articular area when it's extended.
Now that we've seen the bones of the knee joint, let's see how the joint looks in the living body. In building up our picture of this quite complicated joint, there are several structures that we need to understand. First, the two joint cartilages, or menisci. Then the ligaments, the two cruciate ligaments and the two collateral ligaments. Then the patella and the quadriceps tendon on the front. And lastly, the capsule, which encloses the joint.
Here are the two articular surfaces of the tibia. The two menisci sit on top of them. Here are the menisci. They're made of flexible fibrocartilage. They're shaped a little differently. The lateral one is almost a circle. The medial one is more C-shaped. In cross-section, each meniscus is thick at the outer edge and thin at the inner edge. The two ends of each meniscus are attached to the interarticular area of the tibia. The medial ones far apart, the lateral ones close together. In addition, each meniscus is attached all the way around its edge, both above and below, to the joint capsule. Here's part of the joint capsule. We'll see more of it later. The lateral meniscus is much more mobile than the medial one, partly because its two ends are attached close together, partly because of a big difference in the mobility of the joint capsule around the edge. By filling in the spaces between the femoral and tibial condyles, the menisci produce an even distribution of synovial fluid to nourish and lubricate the articular cartilage of the femur and tibia. Now let's look at the two pairs of ligaments which hold the bones together at the knee joint. The two cruciate ligaments on the inside and the two collateral ligaments on the outside. We'll look at the cruciate ligaments first. They're the important structures which prevent forward and backward movement of the femur on the tibia. Their name comes from the fact that they form a cross, like this. Here's the anterior cruciate ligament, seen from in front. Here's the posterior cruciate ligament, seen from behind. To get a better look at them, we'll remove the lateral condyle of the femur. Now we can see the whole of the anterior cruciate ligament. The anterior cruciate ligament goes from here on the tibia to here on the femur, on the inner aspect of the lateral condyle. The anterior cruciate ligament prevents the femur from moving backward in relation to the tibia. Now we'll look at the posterior cruciate ligament. We'll remove the anterior cruciate ligament to see it better. The posterior cruciate ligament goes from here on the femur to here on the back of the tibia. The posterior cruciate ligament stops the femur from moving forward on the tibia. By preventing backward and forward movement, the cruciate ligaments ensure that the condyles of the femur stay in one place as they roll on the condyles of the tibia. Without them, the femur would roll off the back of the tibia in flexion and would roll off the front of it in extension. Now let's look at the two collateral ligaments, the fibular collateral ligament on the lateral side and the tibial collateral ligament on the medial side. The tibial collateral ligament goes from the medial epicondyle of the femur to the anteromedial aspect of the proximal tibia. The tibial collateral ligament blends with the capsule of the knee joint behind and also in front. On its inner aspect, it's firmly attached to the edge of the medial meniscus, which is here. Now let's look at the rather different fibular collateral ligament. It goes from the lateral epicondyle of the tibia to the head of the fibula. The fibular collateral ligament stands out from the side of the knee joint. Unlike its tibial counterpart, it doesn't blend with the joint capsule. It's not attached to the meniscus. When the knee joint is extended, both the collateral ligaments are tight. When it's flexed, they become less tight. The function of the collateral ligaments is to keep the femoral and tibial condyles together, and thus to prevent the knee joint from bending from side to side, like this or like this. In addition to the obvious knee movements, flexion and extension, it's also possible for the tibia to rotate a little on the femur, like this. This rotation can happen only when the knee is flexed. When it's extended, the tightness of the collateral ligaments makes rotation impossible. The next structure we need to add in building up our picture of the knee joint is the quadriceps tendon,
and along with it, the patella.
Here's the distal end of the quadriceps muscle, which we'll see in more detail later in this section. Here's the quadriceps tendon. The patella, which is here, is enfolded within the tendon. The part of the tendon below the patella is known as the patellar ligament. On the medial side and on the lateral side, the tendon is continuous with the capsule of the knee joint. Between the quadriceps tendon and the femur is an extension of the knee joint cavity, the quadriceps bursa. It's lined with synovial membrane. This lubricated pocket enables the quadriceps tendon to slide easily on the femur.
Now we'll complete our picture of the knee joint by adding the fibrous capsule which encloses it.
Here's the knee joint with the joint capsule intact. On the medial side, the thin capsule is continuous with the tibial collateral ligament. But on the lateral side, the capsule is separated from the fibular collateral ligament. On the back of the joint, the capsule is thick and strong. The thickened posterior capsule prevents hyperextension of the knee joint. Here, we've divided the fibrous capsule to see its inner surface. It's lined on the inside with synovial membrane all the way around the joint, except at the back. At the back, as we'll see if we remove the capsule, the thin synovial membrane, here it is, passes forward around the cruciate ligaments, covering them on the front.
Besides being the largest joint in the body, the knee joint is also much the most complicated. Before we move on to look at the muscles which produce knee movement, let's review what we've seen of the bones and of the knee joint.
On the femur, here's the lateral condyle and epicondyle, the medial condyle and epicondyle, the adductor tubercle, and the intercondylar notch. On the tibia, here's the lateral condyle, the medial condyle, the tibial tubercle, and the facet for the fibula. Here's the head of the fibula, the neck of the fibula, the proximal tibiofibular joint, and the patella. Here's the medial meniscus, the lateral meniscus, the anterior cruciate, and posterior cruciate ligaments, the fibular collateral ligament, the tibial collateral ligament, the quadriceps tendon, the patellar ligament, and the joint capsule.
Now we'll move on to look at the muscles which produce movement at the knee joint. We've met most of them already. The one muscle that extends the knee is the massive quadriceps. We saw it briefly in the last section. We'll take a better look at it now. The main flexors of the knee are the so-called hamstring muscles, semimembranosus, semitendinosus, and biceps femoris. Besides flexing the knee, the hamstring muscles also extend the hip. We took a good look at them in the last section. Here, we'll just revisit their insertions. In addition, we'll look at three muscles at the back of the knee that we haven't yet seen: popliteus, gastrocnemius, and plantaris. We'll start with quadriceps. Its name comes from the fact that it has 4 heads. Oddly, these are named as though they were separate muscles. 3 of the heads arise from the femur. They're called vastus intermedius, vastus medialis, and vastus lateralis. The 4th head, rectus femoris, arises from the hip bone. All 4 heads converge on the quadriceps tendon, which we've seen. We'll start with the deepest of the heads, vastus intermedius.
Here it is. It forms a bulge on the front of the femur. Vastus intermedius arises from this broad area around the lateral aspect and front of the femur. wrapped around the outside of vastus intermedius are vastus medialis and vastus lateralis. These two cover vastus intermedius almost completely. Their fibers run obliquely all the way round to the back. Here's lateralis, here's medialis, almost meeting it. Vastus lateralis arises from the lateral edge of the linea aspera and from the side and front of the greater trochanter. Vastus medialis arises from the medial edge of the linea aspera and from just below the lesser trochanter. The thin strip of bone between these two lines of origin provides the insertion of all the adductor muscles and also the origin of the short head of biceps. Now let's add rectus femoris to the picture. Here it is. Rectus femoris arises from the ilium just above the hip joint. Its tendon of origin has two parts, a posterior or reflected part and an anterior or straight part. The anterior part arises from this prominence, the anterior inferior iliac spine. The posterior part arises from just above the acetabulum. All four heads of quadriceps converge on the quadriceps tendon. The lowest fibers of vastus lateralis and medialis insert onto the sides of the patella. The principal action of the quadriceps muscle is to extend the knee. When the foot is off the ground, that action simply straightens the leg and holds it straight. When the foot is on the ground, the action of quadriceps has several important effects. In normal walking, quadriceps straightens the leg as the foot reaches the ground, then keeps the leg straight while the hamstring muscles extend the hip. Quadriceps is also one of the two big anti-gravity muscles of the lower extremity. Its partner, which we've seen already, is gluteus maximus. Acting together, quadriceps at the knee and gluteus maximus at the hip lift the body upward when we climb uphill, when we rise from a sitting position, and when we jump. The same muscle actions propel us forward when we're pushing a heavy load. In addition to these actions, when quadriceps and its partner, gluteus maximus, act in balance with the force of gravity, they control our rate of descent as we sit down. And also when we walk downhill. We need to digress for a moment to look at a structure called the adductor canal, which lies between vastus medialis and the adjoining adductor longus muscle. The adductor canal is important because the femoral vessels run through it in their course from the front of the thigh to the back. Here's vastus medialis. Here are the adductor muscles, magnus behind, longus in front, and brevis up here. The adductor canal is formed by the groove between adductor longus and vastus medialis, and by this sheet of fascia, called the roof of the adductor canal, which bridges over between the muscles. The adductor canal is covered over by the sartorius muscle. We'll see the adductor canal again when we look at the blood vessels. Now let's move on and look at the muscles which produce flexion at the knee joint. We'll revisit the main flexors, the three hamstring muscles, and two minor flexors, sartorius and gracilis. Here are the hamstring muscles again. On the medial side, here are semimembranosus and semitendinosus. As we've seen, they both arise from the ischial tuberosity and insert on the medial side of the knee. Semimembranosus here, semitendinosus here. On the lateral side, here's biceps femoris. It arises both from the ischial tuberosity and from the femur, and inserts down here on the head of the fibula. We've already seen that these three muscles, which usually act together, can produce either extension of the hip or flexion of the knee. Whether they do one, the other, or both
is determined by what other muscles are acting in opposition to them at the time.
When flexion of the knee is resisted by quadriceps, the hamstring muscles produce extension at the hip. When extension of the hip is resisted by the hip flexors, the hamstring muscles produce flexion of the knee.
In addition, the hamstring muscles, acting separately, produce medial rotation and lateral rotation at the knee joint. As we've seen, these movements can only happen when the knee is flexed.
The two semi-muscles produce medial rotation. Biceps femoris produces lateral rotation.
The other two minor knee flexors that we've seen already are sartorius and gracilis.
Here's sartorius, which arises up here. Here's gracilis, arising here. These two insert close to semitendinosus. Sartorius here, gracilis here.
We've already seen the actions of these two muscles at the hip. At the knee, they help to produce flexion. Now we'll complete our picture of the muscles around the knee by looking at three muscles at the back that we haven't met yet: popliteus, gastrocnemius, and plantaris.
Here's the popliteus muscle. It arises from this area on the back of the tibia and inserts up here on the lateral epicondyle of the femur. The tendon of popliteus passes through the capsule of the knee joint to reach its insertion. Popliteus is a minor flexor of the knee, and it can also produce medial rotation of the tibia. Lying on top of popliteus is the small plantaris muscle. It's a vestigial structure. It arises from the lateral epicondyle of the femur. The tiny tendon of plantaris runs down on the back of this big muscle, soleus. We'll see where it ends up in the next section. Lying on top of the two small muscles that we've just seen is the much larger gastrocnemius muscle. Gastrocnemius arises by two heads from the back of the medial and lateral condyles of the femur. Gastrocnemius runs downward and joins with the underlying soleus muscle, which we'll see in the next section, to form the calcaneal tendon, or heel cord.
Gastrocnemius has a slight flexing action at the knee, but its main action by far is at the ankle joint. We'll see it again in the next section. Now that we've seen all the muscles that arise or insert at the knee joint, let's see how they all fit together.
You can use this overview as a brief review section. Here on the front are quadriceps, sartorius, and gracilis. On the back, here are semitendinosus and semimembranosus. Here's biceps femoris, and here's gastrocnemius. Here's plantaris and popliteus.
Now we'll move on to look at the principal veins, arteries, and nerves in the region of the knee. We'll begin where we saw them last, just below the hip. We'll follow them to just below the knee. With the main artery and vein, there's a change of name that we need to understand. In the upper and middle thigh, they're known as the femoral vessels, but below the adductor hiatus, they're called the popliteal vessels. The same vessels, just a different name.
Here's the thigh with the skin removed and a strip of subcutaneous fat taken out so that we can see the long saphenous vein. Here it's in the middle of its course from the ankle to the top of the thigh. To see the femoral vessels, we'll remove the superficial fat and deep fascia. Here are the femoral artery and vein at the point where we saw them last, disappearing beneath the sartorius muscle. To follow their course, we'll remove sartorius and also gracilis. Here's vastus medialis, here's adductor longus, with adductor magnus behind it. The femoral vessels pass beneath the roof of the adductor canal and through the adductor hiatus. To see where they emerge, we'll remove semimembranosus and semitendinosus, and go round to the back. Here are the vessels emerging behind adductor magnus. They're now known as the popliteal artery and vein. A little above the knee, the popliteal vessels are joined by the sciatic nerve. At the back of the knee, the popliteal artery lies deep to the nerve and to the popliteal vein. To see the artery better, we'll go to a different dissection in which the muscles are intact and the nerve and the vein have been removed. Above the knee, which is just here, the popliteal artery gives off these two superior genicular arteries, lateral and medial. At the knee, it gives off these branches to the two heads of gastrocnemius. And below the knee, it gives off these two inferior genicular arteries, medial and lateral. The popliteal artery then disappears deep to the two heads of gastrocnemius. We'll see where the vessels go from there in the next section. Now let's look at the nerves. In the last section, we looked at three major nerves, the obturator, the femoral, and the sciatic. We'll follow the sciatic nerve in a minute. The obturator nerve and the femoral nerve we don't need to follow any further, except to remind ourselves of the muscles that they supply. As we've seen before, the obturator nerve supplies obturator externus, adductor brevis, and longus, and the anterior part of adductor magnus. The femoral nerve supplies iliacus, pectineus, all four heads of quadriceps, and sartorius. The obturator and femoral nerves also have sensory branches, some of which go below the knee. We'll leave these out. We'll go on now to look at the sciatic nerve. We saw the sciatic nerve a minute ago with the hamstring muscles absent. To see the whole picture, we'll add the hamstring muscles. Here are semimembranosus and semitendinosus. Here's biceps femoris. Here are the two heads of gastrocnemius. The space that's bounded by these muscles is called the popliteal fossa. As we saw in the previous section, the sciatic nerve passes deep to biceps femoris. Here it is emerging. Here are the popliteal vessels coming in beneath the semi-muscles and passing deep to the nerve. Above the knee, the sciatic nerve divides into two major nerves, the tibial nerve and the common peroneal nerve. The tibial nerve runs downward in the midline and passes between the two heads of gastrocnemius, along with the popliteal vessels. The common peroneal nerve diverges laterally, running just behind the tendon of biceps femoris. It passes around the neck of the fibula, here's the fibula, and passes into this muscle, peroneus longus. We'll follow the further course of both these nerves in the next section. Of the muscles that we've seen in this section, the tibial nerve supplies popliteus, gastrocnemius, and plantaris. We'll conclude this section by briefly reviewing what we've seen of the vessels and nerves of this region. Here's the femoral vein and artery, the superior genicular arteries, lateral and medial, and the inferior genicular arteries, medial and lateral. Here's the popliteal artery and vein. Here's the sciatic nerve, the tibial nerve, and the common peroneal nerve. That brings us to the end of this section on the knee. In the next section, we'll look at the leg, the ankle, and the joints of inversion and eversion of the foot. In this section, we'll go from the knee to a little below the ankle. We'll start by looking at the bones and the joints of the ankle region.
Then we'll look at the muscles which produce movements at those joints. Lastly, we'll look at the blood vessels and nerves of the region. Before we start, we need to understand the meaning of some anatomic terms regarding the foot and its movements. The upper and lower surfaces of the foot are called the dorsal surface and plantar surface. This part of the foot is called the tarsus. These bones are the tarsal bones. The long bones in front of them are the metatarsals. We'll be looking at two sets of movements which happen in two different places. The upward and downward movements that occur at the ankle joint itself are called dorsiflexion and plantar flexion. The side-to-side rocking movements that occur at the joints just below the ankle are called eversion for turning outwards and inversion for turning inward. Lastly, speaking of definitions, you'll recall that the leg in anatomy means just the part of the lower extremity that's between the knee and the ankle. Now let's look at the bones. We'll start by taking a further look at the two long bones of the leg, the tibia and the fibula. The tibia is much the larger of the two bones. The shafts of the two bones are covered by muscles, except for the anteromedial aspect of the tibia, which lies directly beneath the skin, all the way from the knee to the ankle. The proximal end of the fibula doesn't form part of the knee joint, but its distal end forms an important part of the ankle joint, as we'll see. The tibia and fibula are held together throughout their length by the strong interosseous membrane. Above and below, they're attached at the two tibiofibular joints. The proximal tibiofibular joint is a synovial joint. The distal one is a fibrous joint. There's very little movement at either of these joints. Distally, the two bones are strongly held together by the anterior tibiofibular ligament and the posterior tibiofibular ligament. The projecting ends of the tibia and fibula, which stick out on either side of the ankle, are called the medial malleolus and the lateral malleolus. The articular surface for the ankle joint is a broad notch formed by the curved undersurface of the tibia and the inner surfaces of the medial malleolus and the lateral malleolus. Now let's look at the bone that articulates with the tibia and fibula to form the ankle joint, the talus. This is the talus. The bone below and behind it is the calcaneus or heel bone. The bone in front of the talus is the navicular bone. We'll meet the other tarsal bones shortly. Now we'll go round to the lateral view to see the talus by itself. This is the head of the talus. This is the neck. The talus has three articular surfaces, one on the head and one on the underside for the two joints of inversion and eversion, and one on top for the ankle joint. Here's the ankle joint. Let's see how it looks in the living body. Here, the loose parts of the joint capsule have been removed, leaving these thickened parts, which are the ligaments of the joint. Here's the front of the joint in plantar flexion. Here's the back of the joint in dorsiflexion. On the lateral side, the joint is held together by the posterior talofibular and anterior talofibular ligaments. On the medial side, it's held together by this massive ligament, the deltoid ligament, which attaches not only to a broad area on the talus, but also to the adjoining bones below and in front, as we'll see shortly. The ligaments of the ankle joint ensure that the talus can't rock from side to side, like this, or move backward or forward like this, relative to the tibia and fibula.
Here's the ankle joint with its joint capsule intact and with the rest of the bones in place. The capsule of the ankle joint is loose on the front and it's also loose on the back. This looseness allows for a full range of dorsiflexion and plantarflexion.
Now we'll move on to look at the two joints of inversion and eversion. There's one directly beneath the main part of the talus called the subtalar joint, and there's one below and in front of the head of the talus that has an unwieldy name, the talocalcaneo-navicular joint. We'll call it the TCN joint for short. To understand these joints, we need to get acquainted with the remaining tarsal bones.
We already know the talus, the calcaneus, and the navicular. In front of the navicular are the three cuneiform bones, first, second, and third. Lastly, the bone in front of the calcaneus is the cuboid bone. Now let's look at the calcaneus by itself. The posterior part of the calcaneus forms the heel. The massive calcaneal tendon, also called the Achilles tendon, is attached here. Here on the medial side there's a projecting shelf which the medial part of the talus sits on, called the sustentaculum tali. On the front of the calcaneus there's an articular surface for the cuboid bone. On the upper aspect of the calcaneus there are two articular surfaces for the talus, a small one in front, a larger one behind. The larger of these two surfaces, together with the corresponding surface on the underside of the talus, forms the subtalar joint. The head of the talus fits into a socket, which we'll see by taking the talus away. The socket is formed by this surface of the calcaneus, this surface of the navicular bone, and by a strong ligament here, which we'll see in a minute. These surfaces, together with the head of the talus, form the talocalcaneo-navicular joint. Here's what these joint surfaces look like in the living body. The surface for the subtalar joint, and the two surfaces for the TCN joint. This structure in between, which forms part of the TCN joint, is the upper surface of the strong calcaneo-navicular ligament, also misleadingly called the spring ligament, which helps to hold up the head of the talus. It goes from here on the calcaneus to here on the navicular. The movement that happens at the subtalar and TCN joints is a rocking motion that takes place around an obliquely placed axis. This rod shows the position of the axis. It's oblique to the long axis of the foot, both in this plane and in this plane. Here's eversion, here's inversion, again eversion and inversion.
Several strong ligaments hold the malleoli, the talus, the calcaneus, and the navicular bone together. On the medial side, which we'll see first, there's one extensive ligament to look at, the deltoid ligament. We've seen part of it already.
Now here's the whole of the deltoid ligament. This is the part we saw before, going from the medial malleolus to the talus. In addition, parts of the deltoid ligament fan out below onto the sustentaculum tali of the calcaneus, and in front onto the navicular bone, so that the deltoid ligament holds all four of these bones together. On the lateral side there are two important ligaments. The calcaneo-fibular ligament, which goes from the lateral malleolus to the side of the calcaneus, and this strong ligament, the interosseous talocalcaneal ligament, which goes from here on the calcaneus to here on the talus. To see that ligament better, we'll remove the talus. The interosseous talocalcaneal ligament lies between the subtalar joint and the TCN joint.
Now that we've seen the ankle joint and the joints of inversion and eversion, we'll look very briefly at the remaining joints of the tarsus.
Between the navicular and its neighbours, the cuneiform bones and the cuboid bone, there's hardly any movement, but there is a small amount of rotation between the cuboid and the calcaneus, which lets the front part of the foot invert and evert a little, independently of the calcaneus.
We'll see more of the bones and ligaments of the foot in the next section. For now, we've seen enough to understand how the joints of the ankle region move. Before we go on to look at the muscles that produce those movements, we need to take a look at some important pulley-like structures that are attached to the bones of the ankle region. These are called retinacula, the singular of which is retinaculum. Each retinaculum guides and keeps in place a set of tendons that pass from the leg to the foot. There's a retinaculum on the front of the ankle and one on each side of the ankle, behind and below each malleolus.
Here on the front are the upper part and the lower part of the extensor retinaculum. These aren't isolated structures, they're localized thickenings of this layer of investing deep fascia, which we'll meet later. 4 tendons, a nerve and an artery, pass under the extensor retinaculum. On the lateral aspect, behind the malleolus, here's the peroneal retinaculum. It accommodates the tendons of 2 peroneal muscles as they pass around the lateral malleolus. On the medial side, the flexor retinaculum fans out from the back of the medial malleolus. The space beneath the flexor retinaculum is divided into 4 separate tunnels. 3 tendons and the posterior tibial vessels and nerve pass through these tunnels as they pass around the ankle and into the foot.
Now let's review what we've seen of the bones, joints and pulleys of the ankle region. Then we'll move on to look at the muscles of the leg.
Here's the tibia, the fibula, the medial malleolus, the lateral malleolus, the talus,